Education, health and care plans are designed to make sure children with complex needs get all the support that they need, coordinated together in one care plan. Support from across all agencies, including health, social care and their school. Getting these put together in the current system can be a real challenge, and this is one family's story of some of the obstacles they've come across as they've tried to get the right support in place to help Jake in his move to secondary school.
Jake was adopted from care as a baby, so he came with a slightly traumatic history. He came having been born addicted to various substances. He came to us as a foster child actually, so he had fewer moves than other children do in the care system, and we adopted him as his foster parents. He's been with us 10 years, he's nearly 11. He's been in and out of school and he's currently in mainstream school locally. What I wanted for Jake was somebody to assess him. He's a bright boy, he's got a lot to offer, but he doesn't access learning because his behaviour, his fear, his difficulties get in the way of that. And I needed just a simple assessment that would help us put together a plan for him to go on and achieve at school.
We've obviously been part of ensuring that his educational healthcare plan was up to date and reviewed in light of where we are now. Frustration again is that the period in which where you go from writing that and sending it away is, yeah, it's a 6-7 month process, and in 6-7 months time when that returns, clearly things have evolved, needs have changed. When we sent that off originally, that Jake had been in school part-time for a couple of months. By the time it came back, he was in school full-time. So there's a frustration in those time lags in terms of what the school's trying to do, because on the ground I think we do very well. I think we're brilliant for a kid like Jake. I think where the frustration lies both for Sarah and for the school is that those external advice, support, expertise, knowledge isn't forthcoming with as much immediacy as it needs to be, because Jake is a very, very capable young man, and there are barriers to him fulfilling that potential. And we're a really special moment for him, because he's in a school which is very inclusive, with a parent who's parents who are highly supportive. So all the sorts of planets are aligned in that sense, and I think the frustration lies in the barriers of getting that advice with the immediacy that we need it.
We've been referred backwards and forwards. I think I've actually lost track. I think maybe between 10 and 12 times individually, and then each of those referrals had various stages to it. We originally went to the GP because we needed some health input into the education and healthcare plan. There was nothing from health in terms of advice for school or for me. So I went to the GP and asked for a referral to a specialist clinic. I know of one, but it's out of county, and there didn't seem to be anything within county. So the GP agreed and said, yes, we'll refer you on. We then applied to the commissioning group, and they said, no, you need to go to CAHMS in order to assess we can do it in county. We'd already been to CAHMS, and CAHMS had already said, I think you should go to the fetal alcohol clinic in Surrey. CAHMS didn't make that clear enough apparently in a letter, so the commissioning group maintained their no and said you can't have that, we need to do this within the county. Meanwhile, the CAHMS waiting list is at least 2 years. We were on a time schedule. We'd allowed 3 years for this to happen, thinking that would be ample, but of course it took us so long to get through to CAHMS that we're now at a point where Jake should be transitioning to school and we still don't have any advice. If health aren't involved in the assessment and in the discussion and in the planning, children like Jake just disappear. They just fall through the holes, and then in the end they'll resurface, but they'll resurface in young offenders or in adult mental health or with adolescent difficulties. Our GP supports us. The psychologist has seen evidence of this behaviour. School believe that Jake needs all of this extra help.
Jake should be in mainstream education, in my opinion. In the right setting, he should be. It would be an absolute travesty if he's not. There are, though, factors which, if he isn't supported in the right way and those boundaries aren't there and he isn't understood, and particularly as he moves into secondary education, there's a great danger he'll regress. And I think that can't happen and shouldn't happen. But particularly as we move into mainstream, it's even more imperative, I think, as he approaches his teenage years, that it's not about his mum, it's not about simply his teachers, but it's about other agencies working together. You know, there is no excuse to not do our best for him.
The assessment that I asked for, because it's the only one I know of, would have cost, I think, about £3,500. And I don't know how much money 3 years of trying not to see me costs, but I would say it was considerably more than that. It's madness. It's crazy that there is the support, there should be the support there, and there isn't. And I can identify a route through, and I'm just told no, time and again. We work very hard for all of this not to affect Jake, and we are relatively experienced parents. We have a large family, but there's inevitable fallout. In terms of there being difficulties within the family, that's quite a well-known phenomena within adoptive families. The sort of secondary trauma, compassion fatigue, the fact that you spend all of your time and money fighting the system when you should be concentrating on raising your child is very short-sighted. And in the end, if I'm not in a place where I can support the whole family and all of my adopted children, because I'm battling with the local authority on silly nonsense paperwork issues, then I'm not doing my job properly, and I'm not able to support Jake in the way that I should.
Jake's story shows coordination in planning between agencies and access to specialist services can be difficult for families in our traditional service model. Here's an example also from Cornwall, where in one area people are working together differently with really promising results.
So to start off, just saying something about Bloom itself and how it started. It started primarily because a number of children who had emotional well-being difficulties or mental health problems were being referred by their GPs, but not being accepted as appropriate referrals from the highly specialist CAHMS services, but not having anywhere else for them to go. And so the project took all of those in one particular area and promised them a service of some sort. And the way that it did that was to respond very quickly and to get all the local agencies with lots of local intelligence, the schools, the social workers, the voluntary sector, the youth centres, all to work together to use our local intelligence about all of those children and to find a way to see every single one of them and offer them something.
There was a well-recognised problem amongst primary care, amongst my colleagues in primary care, that young people with psychological or mental health problems were being poorly served. As GPs, if we had someone like that present to us, our routine was to refer them to the CAHMS service, and we had a less than thorough understanding of the CAHMS service, who were really commissioned to see the real sort of tier 3, 4 high-end, long-term enduring mental illness. So we would refer in, CAHMS would reject, we'd be furious with CAHMS would be furious with us for making inappropriate referrals. And we knew that these children were not being well served.
I think working as a CAHMS practitioner, I think if you speak to anyone, we're all very frustrated that there's a number of children that don't get a service and that we're sending children away. So an objective for me is the concept or the idea that every child who comes referred to us is having some kind of service provided for them, an emotional well-being service. So that's a good objective. If that alone would justify its being.
So through what we'd learnt in the Living Well project in the adult to the older adult group, we applied the same principles and actually got together and had conversations and started to break down silos and speak to our colleagues in other organisations. And we went to meet CAHMS and understood, oh, okay, so that's why you refer, if that's why you reject those cases, and rightly you should. We shouldn't be referring them, but what should we do with them then? So we came up with the idea of, what if all the children that were rejected by CAHMS, rightly so, came to a panel, a multidisciplinary panel of healthcare professionals, mental health, primary care, secondary care, schools, education, social services, and key to it, voluntary sector, and all came in the room to discuss these children and their families as a group.
The real advantage of Bloom was it had all agencies in the room, not just one agency, including the voluntary sector. The other advantage is that each child was spoken about very shortly after the referral came in. All of those children were seen very promptly. There was no such thing as a turning down. In other words, the motto, no door is a closed door, it was proved to be very effective.
So the Bloom model is a way to think differently. We try and contact someone that knows the child, a professional, through the parent, with consent and permission, to ask them to come to a Bloom meeting to have a case discussion around the requests and needs of that child, so everyone in the room can think sensitively and carefully about the needs of the child, and we match the right service that we think can then see the child and offer the right support.
My name's Amy Johnson and I'm 15 years old.
What kind of anxieties did you have?
I had anxieties about social situations. I tended to stay indoors all day.
And what kind of support were you offered from Head Start to try and deal with some of these anxieties?
I was offered one-on-one weekly sessions.
And what kind of things have you done in those?
I've done things I'd never do before, like swimming and going to the cinema and going to youth clubs. It's provided me with confidence. It's given me a new positive outlook on life. My family feel very happy about the support I've received. They've noticed a huge change in the way I act and think, and even the way I look. I definitely look different. I cut my hair shorter. I wouldn't usually do that because I like to hide behind my long hair. My future's much different now. It's kind of filled with positive things and the things I actually want to do. Whereas in the past it would have been filled with not really achieving anything because I would have been too afraid, or I certainly didn't have the confidence to believe I could. I feel like they can help with confidence, insecurities, and they can definitely help with mental issues. They provide new opportunities and a chance to be listened to.